Hey YouTube. In this video, I'd like to talk about basically one of the kits that I have. It's modular, and you can see by the red cross on this bag, it's a medical kit. Now, I've got a little bit of medical background going back to my military days, and so I have a tendency to overdo the medical. I acknowledge that up front. This is actually part of my EDC, my everyday carry, so I'm carrying this in my backpack every day. It is modular. I can grab this, put it in my get home bag as needed, tie it into my bug out bag, but frankly, my medical kits that I have in both of those are even much more extensive than this. So this is a pared down, it's about a 5x7 canvas bag, and as with all my bags, it's got a paracord, 5 foot of 550 military spec paracord, and I have it labeled with a tab in case somebody else needs to use it. And because medical is a little bit more urgent, if somebody needs to grab something out of my bag, I put the big red cross on there on both sides so that they know what they're looking for. So without further ado, let's take a look inside, see what we've got. And typically, as with all my kits, I've got it pretty much labeled, broken down into, in this case, I've got it into a couple different categories. First aid medical is one, and then pharmacy, over-the-counter drugs as another. So I've got those kind of separated out here. But as always, I like to have that as a starting point if somebody needs to know if something's in the kit or not. So start out with a roll of waterproof tape. Is always a good start. And as I've mentioned in other videos, bandanas are great, but I use a white handkerchief. This is held in a roll with 2 hair ties, but the handkerchief allows you to use it in a medical situation. You can kind of see how much blood if you're using it for compression dressing or something like that, whereas if you're using a dark or black bandana, you can't necessarily see. The red blood kind of blends in and you can't see as well. So I always start out with a handkerchief and 2 hair ties there. And always never know the situation, so I've got a little 12-hour glow stick as well. And within the, well, I'll get into that in a second. So we've got a couple different bags. Again, you hear me say it before, bags within bags within bags. So that's kind of what I've got here. We'll just go through it. I won't get down into too much minutia, but essentially I'll get into the basics of it. So I've got a pair of tweezers here, which I've got protected with a straw on the end. Basically a first aid guide, a little sheet here for guidance with first aid. Came with a Curad first aid kit. And let's set this over here. And so let's go through some of these bags, see what we've got. First off, I've got creams and ointments and things like that in this bag. So I've kind of got it broken down into a few different categories, but essentially I've got some hydrocortisone cream, got some sunscreen, aloe vera if the sunscreen doesn't work and you get burned. Here's some lotion. And for biomechanical or muscle injuries, etc., I swear by BioFreeze. I use that on all my sore muscles and joints, etc. And I actually just had to use this stuff recently. It's burn gel, and it worked. I grabbed a pan off the stove and the handle when it was in the oven. So I got some burn gel. And then Afterbite, which is great for stings and any kind of, you get bee sting, mosquito sting where you're scratching. That stuff works very, very well. As well, I've got an ammonia inhaler. And this here is another sting relief. This one's just a little different. The others are pads. That one's more of an ampule. So that's some of the ointments and things like that. Here I've got some bandages. I've got a whole host of bandages and antiseptic wipes in here, from large bandages to knuckles to fingertips and small, etc. as well as I've got some antiseptic wipes and some triple antibiotic ointment in this little packet here. And as a backup, I keep another small triple antibiotic ointment. You can't use enough of this stuff, just in case. And I always have extra of that in all my kits. So also getting into some larger, that's for the smaller bandages. You get into more larger trauma injuries. And I've got a roll of gauze. I've got some wound coagulant, instant stop bleeding. Some 4x4s, I got an abdominal pad, a sterile iPad, 3x3s, 2x3s, etc. Just basically compression gauze and things like that in here, more trauma related. And then, in the medical side, and this is where I probably go over the top a lot, but I've got over-the-counter drugs for just about everything. Obviously, I start with Advil and Rolaids, because that's what I use a lot. But I've got cough drops, Pepto-Bismol, multi-symptom cough and cold reliever, and I've got them all labeled. I bought these little bags, I got them at Walmart, and they're specifically for putting pills in. Dayquil, NyQuil, and sore throat lozenges like Chloraseptic, Tylenol Sinus, some additional antacids, generic antacids, Benadryl for anti-itch and antihistamine. I use it actually to help me sleep. Another multi-symptom cold reliever. Can't get enough of these. Antidiarrheals, Imodium. Never want to get caught in a bad situation there. Advil Sinus, some allergy medicine, and some other antihistamines, nasal decongestion, and a natural pain and joint medicines called Arnica, and some Carmex. So, as you can see, quite a host of stuff here. That pretty much takes care of the kit, except for I got a little miscellaneous here, which is always the category of all other. And in that, I've got some moleskin, which I've addressed in other videos. You can't have enough moleskin. You don't want to be limping around on a blister. And here I've got little mini nail clippers, some safety pins, some surgical blades, and a little mini dental kit. It's basically dental repair. You lose a filling or a crown or something like that, and this is the putty stuff that you can pack in there. Because I'll tell you what, if you're out where you're not near a doctor or a dentist and you have a filling or a crown come off, anybody that's ever had that happen, you know how incapacitating that can be. And so cheap insurance there. Don't want to be out in the middle of nowhere or just even where you're away from medical help and have your tooth just drilling a hole in your head. So this is, like I said, pretty much my everyday kit. I do subsets of this as well. I've got Advil everywhere, antidiarrheals, the Imodium I got everywhere in every kit, as well as some water purification and things like that. But this will get you there. Basic first aid, pretty decent. Minor trauma, nothing major. You aren't going to do anything major, with tourniquets or field surgery or anything like that, but it'll get you to the show. So anyway, that's my EDC medical kit. Please leave a comment down below. Anything that's, I'm blatantly missing something here, or anything I should add or take away, let me know. I appreciate you watching. Have a good day.